Alright, so today I'm going to do a manual ventilation to a patient that has an E2 tube in place. So what I'm going to do is I'm going to assess a patient if they're like already on a manual ventilator, and I need to do an ambu bag. I need to get the ambu bag ready. I need to connect it to the oxygen source. So I attach it to the adapter here, and then I turn it up to 15 liters per minute to get a good flow. And then I need to wait to make sure this bag properly inflates. Make sure there's no kinks in the tubing, and make sure that bag inflates before I place it on. So before I place it on, I always need to check the balloon, make sure the balloon is properly inflated, there's not going to be any leaks. So when I go, I take off, if there's a ventilator, I take that off, and then I'd apply this, and 12 to 20 breaths I would do for the patient. And I always make sure this bag re-inflates every time I do it. And if I notice that one side of the lung is only getting, side of the patient's chest is rising, I need to check the tube. So I need to auscultate to make sure that the tube is in the proper placing. And if for some reason that it is too far, I have to be very careful and to move it back just a little bit to make sure I can get it. So then once it is ready, then I can go ahead and do the breath and check again to make sure it is getting the proper oxygen to both the lungs. When I am done, I need to place the patient back onto their ventilator, and if they need any humidity, and then I need to shut this off, remove it from the oxygen source, place it in the proper area, and then I need to reassess the patient to make sure the oxygen is going to both the lungs. I need to listen to the lungs to make sure they're getting the proper ventilation, and check the SpO2 to make sure that is starting to go where it needs to be. Once I am done, I always need a chart in the patient's chart that I had to do a manual ventilation with an ambu bag. And once I am done, I always wash my hands before I leave the patient's room.